Business Power Hour with Darren, Dimples, and the Music Man. Me. Hey, Dimps.
Hey, Mr. Music Man. How you doing this evening?
What's going on?
How are you?
Well, good. What's up? Two ladies. This is a true story. These two ladies at a network meeting came over to me, and he said, your show was really good, but we missed Dimples. Good evening, everybody. I just got the finger from Jim.
It's all part of the story.
Right.
Hey everybody, it's Darren from the Business Power Hour. I'm not going to be in the studio tonight. I'm traveling.
Good evening, everybody, and welcome to the Business Power Hour with Darren and the Music Man, except Darren's not here.
I'm here.
No,
I'm
you're
right
not
here.
Does anybody see that? Darren is not here. Darren is away.
I am right here, right
Be quiet
next
for
to
a
you.
second. You're not here. I don't know if you got lucky.
Not the really interesting question.
That's a fantastic question, Norman.
Wow. See, I got a fantastic. You just got good. I got fantastic.
Show's about him, so let's focus on that. Were you drinking before the show?
Oh, Jesus. Oh, Jesus.
There we go. We got it.
It's good.
No, it's...
Now we got a flaw.
Oh, there you go. Okay.
Smother it.
So, I think you guys are music out there.
It's making noise.
It's making music.
Is it?
Yeah. That's so sweet. That's so sweet of you, Darren.
By the way, this is a Yankee station.
It's a
Thank
Yankee
you.
station. John,
Thank you.
it's a Yankee station.
All right.
Unfortunately...
We got bugs in here. What's going on?
I don't know.
Do you spray? Get an exterminator?
It's that time of year where you're getting bugs and stuff. As long as we don't have bees, I'm good.
Yeah, all right. That's...
But...
We have a lot of undulations out in the field. Undulations.
Is that a wine?
No,
What the hell is undulation?
Fred, don't use big words. Hey, right? So this...
Help.
I gotta get him a cough button, Jim. What do you think?
A cough button would be a good idea. Consider that a good question that he asked?
Great question.
There
you go. I got
Pythons
one.
and brains.
You're double D?
I'm double D. Show's about him, so let's focus on that.
Hey, give me some loving.
How are you, Music Man?
Hello, Darren. How are you?
I'm fantastic. I'm
this week.
absolutely convinced. I'm absolutely convinced that
telling
you
you.
got some kind of brain damage when you had that thing last year.
I'm telling you that, and he called.
It's not classy, but classy.
Seeing interviews by Darren and the Music Man. Ladies and gentlemen, Darren Siafi and Norman Wasserman.
Let's do this.
Yeah.
Good evening, everybody, and welcome to the Business Power Hour with Darren and the Music Man. I got to say this because I wanted to say it every week. There are three things about our introduction that I happen to love, and one of them I have to explain because I've been asked. Well, first of all, the one that I think is the funniest thing is when you tell me that I'm an airhead, knucklehead, I'm out of my mind. That is the funniest thing.
The brain damage one?
Brain damage, exactly. Sorry, Eileen, but that's how it goes. The other one is in the beginning when it says, Jim just gave me the finger. People don't understand. It's not the finger. It's really a finger to tell us that we're on and we're live and we're ready.
We were on the studio when we were live. Jim would point. He would do this. And
I said, Jim just gave me the finger. So that's lasted for a long time as a cutesy. And I got to say that the Yankees won 20-6 last night.
yeah, that was some game.
Well, how many Met fans are there out there? 20-6.
They won 6 in a row. They're now back in second place, and they're
getting their people back. So
they're getting their feet under, and they just got Judge Stanton back. They're getting Judge back.
Stanton got back last night. Torres came back and went back out.
Exactly.
He's back out again.
So, you see my my shirt here?
I do.
You remember
that.
our
Very attractive.
new very good friend Brittany Anderson, who was on a couple of weeks
And
ago,
Mark Puccio.
and Mark Puccio. Well, Brittany sent us these great shirts. I have your shirt, Norm. I got to get it to you.
Thank you.
It's Brittany. Thank you so much. As you see, I'm wearing it, and I got it on, and it looks great, and it fits great, and everything like that. So, we want to just say that she's got a fundraiser going on that we'll talk about a little bit later on. towards the end of the night. We'll give out the information on that. But other than that, how was your week?
Pretty good. There's something very, very hot in the works. That there's a possibility that will happen, and it's would be a mega thing. But we'll see. It'll be a good thing for the people that contacted me and for my business. So if it works, it works. If it doesn't,
Awesome. Good things
that,
are happening, right? The economy's starting to come back. Good things are happening.
yep,
All a beautiful thing. I have had a fantastic week this week.
you did so.
As you know, Monday was my first show on WRCN, Long Island News Radio. I think it went pretty well.
Why don't you ask me?
I did. So what did you think, Norm? I already asked you, but go ahead. What did you think?
After what I gave you my answer, you still want me to tell everybody what I think? I'll tell you what I think. It was really great. Your tone of voice, your pundulations, your articulations. Anthony was terrific.
Yeah.
But he's used to this because he goes to court or whatever. Since he's used to whether it's a microphone or whatever, you're used to it. You had a microphone, but it was done very well, very, very classy, and good job.
And
It
I
was a
want
good
to
job.
thank you because again, without you asking me to do this, that would have not happened. Not only that, I got to the station on Monday and lo and behold, there's this waiting for me. This beautiful basket.
Oh, look at that.
Right. And it's, you know what? It's actually made for me because there is a bottle of Jack Daniels in it.
Really? Somebody must really like you that sent you that. Was that Michelle?
And that's you, my friend. It was
I
from you.
did that.
And I want to thank you for that. That was
It's my pleasure.
That was very generous. It was
My pleasure.
one of those things that helped me get going.
Especially when you drank it.
Yeah, really. That was kind of, settled the nerves in a little bit. I had a couple of
Well,
shots.
that's good. Well, I wish you a lot of good luck with it.
So we're doing good. All right. So forget that for now. I mean, it was great. Next
Why?
week,
Do we have a guest? We have a guest?
Well, here's the thing. I know you had a problem originally. I spoke to the station. If you have iHeartRadio or radio.net and tell either Alexa or Google to play WRCN, they will play it. Long Island News Radio, they will play it over that. So you can get it over the internet too. So Mondays at 3:00, you can catch me doing
Yeah,
it.
but that wasn't the problem. The problem was finding the live button.
Oh, the live button. Okay.
Finding the station and whatever was no problem.
Right.
All right. And I saw your commercial for it, but anyway, we have a guest.
Yes, we have a guest.
It's almost like he's a fixture on our show. He comes on so often, one way or another. He either brings charities or he comes and he talks about himself.
Well, here's the thing. Usually before the show, for those who don't know, before the show, we go through, here's how we do the show. This is what we're going to do. And this is how we're going to do it. And we didn't have to do that tonight.
He was asking us if we could do some extra stuff because he knew everything that goes on.
He knows how it all works. So we're gonna accommodate him best. So
we gave him the finger.
Exactly. So let's bring in Medicare Mike.
All right, here comes Medicare Mike, everybody. Back to the station. There he is.
There he is.
Hello, everybody.
Look at those high cheekbones.
The high cheekbones.
He's got high cheekbones.
How you guys
Look at
doing
him.
tonight?
We're doing great.
Good.
Mike. How
Welcome.
are you?
Welcome, Medicare Mike.
Excellent. Thank you for having me again.
So Mike, it's that time of year again, huh?
Yeah, it's fastly approaching annual enrollment period.
So explain to everybody what the annual enrollment period is, because most people think, okay, I can just sign up for my insurance and my Medicare and all that other stuff at any time.
Also known as annual election period. It's the one time during the year that everybody that has a Medicare plan has the right to choose a new plan for the following year. And that always runs from October 15th through December 7th is the time frame they have to switch from one plan to another if they so need to. But this month, September, it's what I call ANOC month, Annual Notice of Change month. Everybody's going to start receiving, if already haven't, a letter from their insurance company or a little booklet called Annual Notice of Change. That's going to tell them everything they have about their plan this year and what it's going to look like next year. And if you don't read that, shame on you, because that's going to give you a lot of information. And so please read that annual notice of change. And any problems, you can give me a call. Any questions, I'll always be there.
Okay, so, you know, I'm getting close, right? I'm in my mid 50s now. Okay, in a few years, 7 years, was it 7 years? When are you eligible?
65.
65. So I got 10 years, right? So I got to start planning for my Medicare days and things like that. So let's fast forward 10 years from now. Now it's time. I'm coming up, you know, say I turn 65 in June. Can I sign up for Medicare at that point?
You can actually sign up 3 months before your 65th birthday.
Okay. All right. But if I find out, not, you know, say I don't have a guy like you.
Mhm.
I don't have a Medicare Mike that guides me with the right thing. I sign up for things that, you know, I shouldn't have went with this provider. I should have went with that provider.
You're screwed.
So I'm screwed,
You
right?
need Mike. Everybody needs
Well,
Mike.
everybody needs Mike. We know that, but what I'm getting at is, how do I fix that? How do I now fix it? I have to wait until that October 15th to December 7th time period to.
No, you definitely don't want to. You need to have your Medicare in place. If you need both parts A and B, you have to have it in effective the first of the month you were born in. Unless you were born on the first of the month, then you can have it the month before. So you should really look for somebody. You can do it on your own. Signing up for Medicare Parts A and B used to be, you can go to the Social Security office, but they're closed right now. You can sign up online. You need to have a My Social Security account. People get a little bit confused with these things.
Okay, wait. You just said something. My Social Security.
Mhm.
What is that? My Social Security account.
It is actually an account you set up with the Department of Social Security that does a few things. One, it tells you how much your Social Security benefits will be at certain ages, 62, 65, retirement age, or age 70. 70 is full benefit. But it also is what's required. You need to have that account set up in order to even sign up for Medicare through the internet. And I actually come to people's homes or do it through Zoom and help them do it.
Mike, let me ask you a question about just what you were just talking about, because
Mhm.
this comes up. I mean, I get some phone calls sometimes asking me what I did in my life and so on. First time you can get a check is what, 62?
Correct.
Okay, then that's not as much as it would be in 65, and then not as much as 66 and or 70. How does one, outside of saying I absolutely need the money now, how do you decide? Is it better to take it just in case you don't know what the future is going to bring, and you want the money, but so it doesn't, you're entitled to it. You put it in there. All right, what does the average person do?
I can't speak on the average person because everybody, similar to Medicare, Social Security benefits are individualized. I would refer you to your accountant, your CPA, to help you decide what is in your best interest as far as Social Security benefits go.
Okay, so let me ask you this, Mike. What if a CPA really, you know, they're not planners, they're not, because you get a lot of guys who are CPAs, who are accountants, who are just what I call historians. They only care about what happened. They don't really care what's going to happen. And they don't
Plan.
provide the plans. And I run into it all the time. I pick up clients because of this, because they're not proactive in, you know, planning for their clients.
Mm-hmm.
Right. So would you, and this is what I always recommend, is just not me providing that information. It's me and a financial planner of sorts. Okay. That, you know, because even if you have nothing, you still have to financially plan for the future.
Absolutely correct.
Okay?
I should have added the financial planner into the mix from the
Yeah,
beginning. That is
typically, you know, that's the way I do it.
Right.
You know, and I would recommend that if they're going to work with somebody like you, that you get your, not only your accountant, but your financial planner involved also to help you through the process. I just had a conversation with some financial planners last week with a client, because we're tax planning for that client. We're getting ahead of where we need to be and make sure that we got everything covered and taking all the advantages that we can for them. That's becoming more and more, well, I'm seeing, and the way that I do business, that's becoming more the norm, where it's a team effort, right? And you be
Correct.
part of the team. So if I had somebody who's coming up on 65, I'm going to say, okay, let's bring Mike in. He's the Medicare expert. Let's make sure we got all the right coverage and you got everything that you need, so we don't have any hiccups.
Correct. There's another person you would probably want in the mix as well, an elder care attorney.
Yes. Yeah, because you got to look, that's the other thing too. People don't realize, they go, okay, I got a will. Yeah, but you wrote the will 30 years ago.
Yeah.
Things are very different today. You should be revisiting your will every couple of years, right? Every year or
Correct.
2 years, you should really revisit your will and see if any major changes need to be made, and then get in touch with your but elder care attorneys, because they're going to help you through those loops.
Yep. Correct.
Again, they're not the end all be all. I think that's the point I'm trying to make, is you're not the end all be all. I'm not the end all be all. Financial planner is not the end all be all. An elder care attorney is not together as a group, we are.
It's a team effort.
It's a team effort. And
So
that's really what people should be focused
Tell
on.
us now, Mike, how you get started. Somebody reaches out to you, that they find you in one of your shops, in your stores. They stop by where you are. They'll make an appointment. They'll give you some information. You go see them. How does the whole conversation get going?
First off, I have to find out enough information about them so that I can properly research for them. Medicare, and I say this all the time, there's no one Medicare plan for everybody. It's individualized. So I
So
need
what do
to
you
know.
ask them? What do you ask them to get started? What's some of the questions?
I need to know all their doctors, their names, the exact office address they go to visit the doctor, what kind of doctor they are, what medications they're on, prescription medications, the name, the dosage, how often they take it, what pharmacy or pharmacies do they use, what hospitals, if they had their choice, what to use, same with urgent care centers, things like that. And then I can research the plans and find a fit that's going to match them, or fits that are going to match.
Well, let me ask you a question. What does it matter what my doctors are? And what does it matter if, what drugs I'm taking?
Everything, in my opinion, is to keep the cost at a minimal out-of-pocket outlay for the beneficiary, the Medicare person. And if you don't do this research and the doctor's not in the network, and you give them an HMO as an example, now all of a sudden they can't see those doctors. Or even if they have a PPO, which allows them to see out-of-network doctors, they're going to pay more because the doctor isn't in the network. And it is my responsibility, my fiduciary responsibility, to ensure I'm doing what's in the best interest of each Medicare individual.
Mike,
Doesn't
Medicare-
Medicare,
On Facebook, all right, from actually our friend Brittany Anderson, Pink Positive.
hey, Brittany,
All right, she wants to know, do you work with younger people that are disabled?
Absolutely. Anybody that is Medicare eligible for any reason, Social Security, disability, starting the 25th month. If they have end-stage renal disease or Lou Gehrig's disease, and they're Medicare eligible, I can absolutely help.
So Mike, how can they get in touch with you?
Very simple. My phone number is 631-392-8268. That's 631-392-8268. My email, askmedicaremike@gmail.com. And I have a website, medicaremikeny.com.
can you deal outside of New York?
I am now currently licensed in New York, New Jersey, Pennsylvania, Nevada, North Carolina, and Georgia. And I can get licensed in any other state.
What the hell happened to you? You were just in New York. Look
Hey,
at you, you're all over the place now.
it's the COVID effect. I can operate from my own computer with the people being at their own home.
I think it has to do with the business power hour. That's what I think it has to do.
I give you the credit.
What?
Great point.
Oh, some of it anyway.
Norm,
Absolutely.
did you pick up on that Mike read his phone number twice and we didn't have to tell him?
Exactly. You think he knows? You think he knows the situation?
He's got it down.
That's what people got to realize. You want to be on the show, we can possibly help you like we help Mike.
Yeah.
Absolutely.
Got to come on the show.
If you're not on the show, you're crazy if you're a business owner.
It's thanks for the,
Perfect.
that was perfect, Mike.
Way to go.
How we practiced it.
There you go.
Took you 4 trips here to figure it out, but
Hey.
that's it.
Hey,
Better late than never.
thick Irish.
You got it. All right, so Mike, if we're doing everything that we're supposed to do, right? But we run into a situation or a problem mid-year. And I don't, it could be, the provider isn't doing the thing that they're supposed to do, how do I get out of, or the plan that I have, all of a sudden, all my doctors are no longer on the plan or in the network. And I have one of those plans where it's an in-network plan. And, I signed up with them because originally my doctors were in there and now they're gone.
Right.
Right. What do I do? Do I got to
There-
now switch all my doctors?
That's hopefully the last resort. There are things called special enrollment periods during the year that will potentially allow you to switch plans outside of the annual election period. New York has a big one called EPIC, EPIC, Elderly Pharmaceutical Insurance Coverage Program. It allows you, besides helping you with your prescription drug costs, it allows you one time a year, anytime during the year, for any reason, to switch plans. You have to meet certain qualifications, but that's potential. If you move from county to county, you can switch plans. If you move from state to state, you have to switch plans. And if you're on Medicare and Medicaid, you can switch several times. And if you're on low income subsidy with the federal government, also known as extra help, you can switch plans. So it's my job to see if there's a special enrollment period, or they have to turn around and switch doctors until next annual election period, when we can't switch plans.
Now, Medicare also has a plan that's all in, right? So you don't need a AARP, or you don't need an extra one, right? You don't have to worry about that piece of pizza that gets left over on the tray, and it's all inclusive, right?
No.
That's what I said, no.
If you go with original Medicare, I promise you, you'll probably become bankrupt. There's original Medicare has limitation on hospital coverage.
What do you mean by original? Okay, so if you could, Mike, and I know you've been on the show a couple of
Mhm.
times, you've explained it to us, what it is and all that other stuff. So tell us the difference between Medicare Part A, Part B, Part C, Part D. What's the differences? Because you hear all of these terms being thrown around. Most people don't even understand what they're all about. And you just said the original Medicare will bankrupt you. Right. So why? What's the difference? Give me, little things about each area there.
Sure. Original Medicare consists of Part A and Part B. Part A is your hospitalization coverage. Part B is your medical coverage. There is no prescription drug coverage under original Medicare. With the hospitalization, you would have a $1,408 deductible every time you go in the hospital this year. And there is not unlimited coverage days. So at a certain point, you would start paying an awful lot of money per day if you were in the hospital. Part B currently comes with a $198 annual deductible, and you have to pay 20% of all out of pocket. You have to pay 20% of all costs, and there's no end in sight. There's no cap. Then you have to buy a prescription drug plan just to be compliant with the federal government rules.
Wait. So the federal government's saying, hey, we're going to give you this insurance. I'll give you this opportunity to get this insurance. But then we're requiring you to buy more insurance.
Right. Part D.
A portion of the insurance, not prescriptions.
Yeah, they don't cover prescriptions. In
2000,
2006, they made it mandatory that everybody has to have a prescription drug coverage. By the way, Part B is not free. Part B, you have to pay for out of your pocket. Minimum premium this year is $144.60. The only people
a year or a month?
A month.
A month.
And the only people that don't have to pay it are those that are on Medicaid and have a certain plan within Medicaid. So,
or an outside plan that covers the cost.
There's no outside plan that covers.
AARP does, don't they?
No, it doesn't. Part B is your responsibility.
No, not Part B. I'm talking about in addition. So
yeah,
okay.
That's called a Medicare supplement. And this is my humble opinion. 98% of the general public do not need a Medicare supplement. They're spending oftentimes spending a lot of money, and they're not reaping the benefits that they can with a Part C plan, a Medicare Advantage plan. These plans have evolved tremendously in and out of network, nationwide networks, giving coverages that original Medicare and Medicare supplements don't give, include prescription drug coverage with premiums as little as $0 a month.
Well, that's what you want. You want the $0 a month coverage, right?
Yeah. And then you just pay little co-payments as you go.
Okay. All right. So when we
And this-
come back, we're going to take a short break, right? Because Norm's got some big news he wants to do. But when we come back, we're going to continue with Medicare Mike. We're going to find out some interesting things that he's not only doing with Medicare and that, but also for veterans. So, stick with us. We'll be back in about a minute or so. Actually, we'll still be on the screen, but Norm's lovely face is going to be running here in a second. So, all right, Norm, here we go, man.
Hey everybody, it's Norman from Friend Entertainment USA and Virtual Tribute Concerts. I got some breaking news. If I sound a little bit excited, it's because I am. And you can see I'm wearing one of my nice glitter jackets for on stage. And the reason why I'm wearing this jacket is because the Cure, the Friend Entertainment fundraising Cure, it's official, it's live, it's well. We lived through it, we got it going. Concerts all over the country, concerts all over the world. Virtual concerts from Friend Entertainment USA and Virtual Tribute Concerts. We are there. Our next show is coming up. Neil Diamond going to be in a couple of weeks. Tune in, Friend Entertainment USA, 631-698-9696. If you are a charity, if you are a not-for-profit organization, you haven't done fundraising in 6-7 months, I got you. We got this done. I can do it for you. How do I know? We found a solution. I just got finished doing 2 very successful shows. And our next one, as I mentioned to you, is Neil Diamond in just a couple of weeks. So again, Friend Entertainment USA, 631-698-9696. I look forward to speaking to you. Have a good day.
Have you lost control of your business? This is business consultant Darren Sayafi. Listen to me every Monday at 3 p.m. as we discuss strategies and solutions where you can regain control. That's every Monday at 3 starting September 14th, right here on LI News Radio.
I had to slip that one in.
Look at us. We're like
Look at you,
kicking
man.
it.
Yeah, it actually looks like we know what we got things going on, right?
I mean, really, look at that jacket that guy was wearing.
Yeah, wow.
My God.
You know what, though? I think you need to wear the silver one.
That was silver. That was silver and black.
Yeah, but it was mostly black, right?
Yeah, it was mostly black. No, actually, you like the one with the flowers on it.
That's, the one with the flowers on. That's the one that pops.
That's it.
That one.
I'll save that one for Mike one day.
There you go.
So, Mike, tell us about.
Oh, wait one second. That's Chris Gannon, by the way, everybody, who did that.
Ready Set Studios.
That video for Darren and the video for me. He's our guy.
He did my website too.
Oh, and he did yours too, right?
Yes.
Like, what a happy family we got here.
It's a team effort.
There you go.
We
That's
talk about
what
that,
we do.
right? It's all about a team effort.
All from networking.
And that's exactly, how we all met each other. Okay.
And people say networking isn't worth it. You can't do it.
Right. So we got a question from Chanika Latrice. And Chanika is asking, my mother is retiring soon, and her union plan told us she will have drug coverage at no cost for life, but she will have to pay $235 a month for health coverage. Can she keep the drug plan and get health coverage through you?
Absolutely. There is a plan not only for this situation, but also for veterans that have VA coverage. It's called MA only or Medicare Advantage only, without prescription drug coverage. As long as your mom's plan is deemed creditable, and a group or union plan usually are, then yes, mom can keep that coverage, get a Medicare only plan, Medicare Advantage only plan, and proceed on. The other benefit of most Medicare Advantage only plans is they actually will give a give back of part of your Part B premium. Where I'm at out here in Long Island, it could be as much as $50 a month coming back to you from your Part B premium. That's pretty substantial. And the plan itself has zero premium attached to it, and there's other benefits with it as well. So
Darren,
yes,
did this young lady say where she was from?
No, Chanika did not. We got a bevy of questions right now, so I'm just
Give Chanika your phone number again right now, because
Sure.
she's hot. She's ready for you.
there you go. Give this to your mom, Chanika. 631-392-8268. One more time, 631-392-8268.
all right. So here I got more here. I gotta roll through here. Okay, Alyssa Capriso Morris. How do you sign up for Medicare if the Social Security offices are closed?
Again,
Give me your phone number.
You do
Yes,
it right
no.
through Medicare Mike, right?
That's
Yes,
what it is. You'll do it.
I will gladly sign anybody up, help sign up with getting both of my Social Security account if you do not already have one. And by the way, everybody who has got a job should sign up and get a My Social Security account and keep track of your Social Security benefits throughout your lifetime. And then I can also
At
sign
any
you up.
age, you
At
should
any
get that
age.
account.
Absolutely, any age, as long as you're working and you filed income tax, they have an account ready for you to set up. And then from there I can sign you up for parts A and B right away, or just part A and
take
B
care of
later on.
I said you can take care of everything for them.
I can do it all.
All right.
One-stop shopping
At what phone number?
at 631-392-8268.
All right, we got a lot more here. So
Okay.
So Katie Stanley, I am turning 65 and on Medicaid. Should I drop Medicaid and get Medicare? Or can I have both?
Absolutely can have both. In fact, you'll probably have to recertify with the Medicaid once you turn 65. But the good news is if you have both Medicare and Medicaid, there are plans designed specifically for you that you will have extra benefits. You won't have any premiums, no co-payments for anything. No doctor co-payments, no hospital co-payments, all your testing, everything at no cost to you. Can get over the counter up to $100 or more a month over the counter goods, a card for that. Healthy food card up to $50 a month. All kinds of benefits if you have both Medicare and Medicaid.
So Mike, okay. So now the next question, Joanne French.
Wait, do you know any of these people? Are these stage calls?
Joanne is my friend. So yes.
Okay. So Joanne's saying, okay, and it goes back to what I was talking about before. What happens if my doctor drops out of the network with the plan that she has now?
Call me again, 631-392-8268. I will do the research to find out if you're eligible for a special enrollment period. And if you are, research the plans and get you to move over as of the first of the following month.
You know, Mike, you're going to win the award over the last 3 years that we've been doing these shows of giving out your phone number more times than anybody else has ever done.
Well, I'll take that award.
There you go.
There we go. All right, Sydney Cullen Wright. My dad will turn 65 next April. Does he have to apply for both Social Security and Medicare at the same time? I know he doesn't want Social Security just yet, but he wants Medicare.
Now you can get just Medicare. That's no problem. You still need that My Social Security account, but then you would just apply for Medicare and you can hold off on getting your Social Security benefits to your 66 and 8 months or 70. But know this, your Part B premium will be billed to you on a quarterly basis until you collect Social Security.
All right. And comment from Chris Gannon. Hi, guys. Medicare Mike is the best. Yeah, Chris.
Well, thank you, Chris.
Yeah,
He has so much to say, Chris, doesn't he?
Yeah,
he's got a way with where he's good with the camera.
He's very good.
He's good on the computer, but as far as talking, a little bit light on the talking. What do you think?
We're trying to get the long shots done because we tried to do something in my backyard and his camera's lens just wasn't working for us.
Well, look at the property you got. How far out do you want him to go? I mean, really? Is it by the pond or by the pool?
I assume to the horse barn.
Oh, it's past the horse barn. Oh, it's past the horse barn. He
All
just
right.
extended the horse barn.
So we got, um, here's where I want to go next. Mike, you do something else, and you do something that's going to help a lot of our veterans and that type of thing. And we actually have a question here from Brad Gibson, right? How would Medicare work with my dad who goes to the VA and he has A and B and is told he is fine? Is that enough, or does he need more?
In my opinion, he needs more.
Okay.
The VA, a lot of places, the VA hospital could be a half hour to several hours away, the nearest hospital. Or they're closed, it's on the weekend, or you're not feeling well and you don't want to drive to the VA. If you have a Medicare plan, which Medicare plans work very well with the VA benefits, not only VA, but TRICARE, and Champs for Life, Champ VA, sorry, all military type coverages. It works extremely well in addition to and with. So you can absolutely have both a Medicare Advantage and VA coverage, or TRICARE and Champs VA. All wonderful coverages that go well with Medicare and Medicare Advantage.
Is Champ VA and TRICARE, are they insurance companies?
No, they are benefits given to certain military people, whether they've retired or left the military because of a disability. They are entitled to benefits, or they're the spouses of and children of those who retired or have died due to service-related injuries.
Now, we had through you a bunch of your friends and people that you know from the American Legion on here a few weeks back. And I was like really shocked to find out that these vets, when they leave, they're not, now they are, but in the past, they weren't educated at all on about the benefits and such that they're entitled to for their service.
Correct. When I left the Army in 1979, I wasn't told anything. Nowadays, there is more education involved. But yeah, if you're a veteran and you have no idea what you're doing, please reach out to me. Reach out to, I see what you have up on the board right now. If you notice that there's questions, you can call me, the number's there, or you can go to Advocate Health Advisors. Wonderful group of people that all we do is help veterans. And there's a lot of services and benefits that they may not be aware or entitled to.
And that's what we found out through having your people on and everything else, is that these veterans are not getting the education that they need in order to get the benefits that they deserve and they're entitled to when they leave the service. I mean, it's absurd with the way that they treat.
I got it. If you got a minute for a quick story, just within the last 2 weeks, somebody who was referred to me had me over. Her husband has early onset dementia and was subject to Agent Orange in Vietnam, and was told multiple times that there's nothing they can do. He's got a small hearing problem, so they gave him a benefit. True Advocate for Health Advisors, the Veterans Administrative Procedure. We've found additional benefits. They were told by state senators one thing, and we guided them. And literally, I got a phone call yesterday from the wife thanking me as paperwork is being processed. They believe they're going to be increasing the hearing benefit. They told her that get the certain doctor to state that it was probably PTSD related dementia, and all of a sudden all kinds of benefits open up. She was worried about what she's not going to be able to care for him forever. If he gets a 30% disability from the VA, they're going to provide housing, all kinds of stuff. So
there you go.
It's amazing what can be done for veterans.
And how does someone get in touch with you?
631-392-8268. Again, 631-392-8268.
If you're out there and you're having a problem like Mike had just said about this other lady, reach out to him. The worst that can happen, he can give you an answer. That's it.
So I'm kind of nervous about asking this next question because I don't know
Uh-oh.
where it's going to go.
Uh-oh.
All right. So Stephanie K. Fish says, hello, Mike. Can you please explain the donut hole? So
Aha. Very good question. A great question, Steph.
What was the question? Can you explain what?
The donut hole.
Oh boy, no wonder you didn't
Let's
want to
not
ask
go
that
off the-
question.
Yeah, Norm, let's not go. Yeah, I'm worried about you going off the rails.
I know that's what's your problem. I get it.
It has nothing to do with diet food or non-diet food or any other jokes you could come up with.
Those
The
are called munchkins,
Yes, true. Well,
right?
the donut hole is a very scary place to be when you're on Medicare. It's got to do with prescription drugs. And I'll use 2020 numbers as the example. Once you and your insurance company have spent $4,020 on prescription drugs combined, you're going to enter the coverage gap or the donut hole, where you will have to pay up to 25% the cost of brand name drugs until you out of your own pocket individually have spent $6,350 before the costs come way down. In New York, there's a great way of avoiding a good portion of it or most of it by getting this Epic, which I briefly talked about before. I don't want to go into too much detail, but if you qualify, that's going to be a saving grace. But the donut hole, that's every insurance company, every plan have to follow these guidelines. They're set up by the Centers of Medicare and Medicaid.
So okay. If Medicare, Medicaid's there for, our older adults who are basically on a fixed income at that point, they really can't afford a lot of money. But you're telling me that, and this is the time in their life where they need the prescriptions,
Right.
right? And now we're saying, okay, for the first $4,000 worth of prescriptions, which in today's day and age is that money goes like that.
Right.
You're pretty much covered. And then after that, you got to kick in another 6,000 up on top of which equates 25%. So what you're telling me is that you got to spend another $25,000 on prescriptions before the cost is going to come down?
No. Back up a second. The $6,350 number is including what you spent out of your own pocket in the 4,020 number. So that's a combination of 4,000 numbers, combination of what you spend out of your pocket in co-payments, plus what the insurance company spends.
Okay, so give me an example. Standard. What's
Sure.
my co-payment on the initial 4,000?
Okay, it depends on the tier. There's 5 tiers in the world of medication. Tier 1 and tier 2 drugs are the generic regular medications that can run you anywhere from $0 a month, a 90-day supply, to maybe $30 a 90-day supply in a preferred pharmacy. Tier 2 drugs between $5 and $30. It's again. Tier 3 drugs you're now spending $47 a month, or $141 a quarter. Tier 4 drugs, you're spending $100 a month or $300 a quarter. Tier 5 drugs, you're spending 25, 26, 27, 28%. So it could add up. Tier 1 and tier 2 drugs really don't affect the donut hole that much because the cost is minimal. But once you start getting in tier 3 drugs, if you have COPD, or you're on inhalers, or if you're on insulin drugs, these things start adding up drastically. And yes, you could be in a donut hole. I have a client on a medication. 1 month's supply is $16,540.
So they got to come up with the $6,300.
They hit it real quick. So even when you leave the donut hole in that case, and you don't have Epic as an example, you still got to pay 5% on a $16,000 drug. You're still paying $800 a month.
Yeah.
So yeah, the donut hole can definitely devastate you, but there are ways out of it. If you're a married couple in New York making $100,000 or less, or a single making $75,000 or less, and you don't have Epic, again, call me because I'll get you on Epic and you will save.
You know what's really cool about you too? You are so passionate about what it is you do with your sales life. I mean, you really want to help these people. It's not
Absolutely.
dollars and
Wait,
cents
I
with
just
you
thought he was excited to be on the show.
to be with
Just
me.
you and me.
Well, you're too pink positive for him.
Hey, pink
Hey.
positive is the only way to go, man. Pink
That's
positive.
right.
Be pink positive. So, Mike, this all sounds very complicated. I don't know how anybody could not reach out to you. And now, look, if somebody's across the country, like our friend Brittany is actually in Washington, right?
Right.
She's in the state of Washington. If she wanted to ask you questions or, needed guidance on where to go and what to do, would you pick up the phone for her?
Absolutely. Anybody, anywhere, anytime. I've always said that. I will answer anybody's question. Catch me on Facebook. Catch me anywhere you can. Absolutely.
And on Facebook,
Can she
Medicare Mike, right? Medicare.
Yeah, ask Medicare Mike.
can she or can you get certified in the state of Washington?
Absolutely.
So if what does it take to get certified in a state?
Getting a non-resident license in the state normally takes between 1 and 5 days to get licensed in the state. And then make sure I have the carriers that work well in that state. And if they need to get certified with the carriers, then it'll take a little bit longer.
So Brittany spoke to you and she helped you get that, or you get that over the internet, the license form, you filled it out. And 5 days later or 2 weeks later, whatever, you're certified in the state of Washington. Boom, done.
Absolutely.
There you go.
So we got another question from Pilla Kleinman. What is the MA only plan? I heard this is a Medicare plan for my health only. What if I don't need drug coverage because I get it through the VA?
That's where the MA only plan comes in. It's the perfect fit to go along with VA benefits. When you have full VA benefits or you have enough VA benefits where they're giving you the prescription drug coverage, that's deemed creditable in the world of Medicare. So therefore you can get an MA only Medicare Advantage plan that will take care of your health outside the VA. This way, if you need a second opinion, you go see a VA doctor and he says you got something wrong with your liver and you want a referral, they're going to send you another VA doctor. Not saying VA doctors are bad, but VA doctors aren't in the business of contradicting another VA doctor. You want a second opinion outside the VA with a Medicare Advantage plan, boom, you can go see a regular doctor, pay the co-payment, get a second opinion, and feel happy, knowing what the outcome is or knowing you need to proceed. It gives you all kinds of leeway outside of the VA benefits, especially time. And if you can't get there and you're just feeling ill, want to go see an urgent care center, you can't do that with the VA. They're closed if they're closed. See your urgent care center under the MA plan. And if
Now, Mike, you work for Advocate, right?
I work for myself. I am licensed through Advocate. They are
That's
my
what I mean.
field
That's what I
marketing
mean.
organization. Yes.
Are they located in every state?
Yes.
All right, so doing somebody like a Brittany or whatever the person's name would be in the state you're not in, you could use Advocate also.
Absolutely could. No question about it. Yes, they have agents in every state in the country and territorial managers in every region. So yes, no question about it. And the one thing about Advocate Health, veteran owned, veteran operated. They are sticklers to everything. They are phenomenal to work with. And if you were to call the phone number, within 2 rings, they pick up. That's how quick they are. They're there to help in any way possible.
Okay, so if you want to get in touch with Mike, all of his information currently is on the screen. So, reach out to him. His phone number is on there. His email's on there. His website is on there. You got to put your Facebook thing on.
Yes, I do.
So, on Facebook, you can get a hold of him on Ask Medicare Mike. That's his Facebook.
You should ask your website guy to put it on for you. I don't know who this guy.
Now this was done before I had the Facebook page. So.
Oh, sure.
Chris didn't do this. This is
I didn't say he did.
Did we say that?
Well, you go to my website, you're going to see my Facebook info.
Oh, that's good.
And LinkedIn.
That's because that person knows what he's doing, or
Absolutely.
she knows what she's doing, whatever. That's good. Are you doing anything special? Well, you're in that tough time now where you're real busy. Where you going to be this weekend?
I have a table right now set up at my the bank I branch of the bank I deal with, People's Bank, on 955 Little East Neck Road in West Babylon. I'm there every Saturday during the month of September from 9 to 11. Starting October 12th, every Monday from 10 to 2, and then 3 to 6 every Thursday from 2 to 6, and every Friday 10 to 2. I will be at the Walmart super grocery store neighborhood market in Levittown on Hempstead Turnpike, and that'll be right through to December 7th. And I'll be setting up appointments. And
for those people who see you, Mike, they can't sit there and wait for you to come up to them and say, "Hey, you want to talk about Medicare?"
No, they have to cut.
Right? Because it's a weird, whacked out law, right?
Right.
Tell us about that law. And because the first time you told me about it, I was blown away because it's the stupidest thing I've ever heard.
Well, financial planners have that same problem.
Yeah. We are not allowed to confront anybody that we have no relationship with to tell them
what you do,
what I do. So how do we get around that? I wear buttons that say, "Ask me about Medicare." I have a face mask that says, "Ask me about Medicare." I get my face out there as much as possible, but I literally at the bank or literally at the Walmart, I can sit there and I can smile. I can say hi. I can say bye. How you doing? But I can't say anything about Medicare. They have to approach me.
So you could be standing there and listening to somebody's conversation, and you hear them say, "I got to get insurance. I got to get Medicare. I just turned 65. I can't afford this anymore." And you can't say anything unless they turn to you and
I can't even walk up to them.
Even though you know they need the help.
Correct.
You know, and if you remember last year, I told you I was in a Starbucks and somebody came up to me asking me if I was an insurance agent. Why, I don't know, but they were looking to get Medicare. And I said, "Oh, I know the perfect guy." And I gave him your name.
Thank you. See, you can do that.
Right.
You're not obligated to do it. You don't have the requirement I do.
Wow, that's why.
There's a couple of professions that have to do that. They have to get approved by whatever, whether it's accounting or whether it's financial planning or life insurance, and you can't. They can't come on the show unless they get clearance.
Well, no, it's accounting's fine, but typically it's financial planners and and you guys, insurance guys.
Life insurance.
Yeah, life insurance. That's another one. But other than that, it's pretty much free reign. We go to town on that.
Are there any more questions for Mike that people called in?
Let's see. Gwen Anderson loves my shirt. So thank you, Gwen. It's all because of Brittany. It's a beautiful shirt.
That's right. Let's hear it for Brittany.
Okay, so Sydney Cullen Wright asks, "Can my dad deal with you over the phone or email, or does it have to be face to face?"
No, does not have to be face to face. I can do it over the phone. I can do it on over the computer on a Zoom meeting. I can still do face to face if that is what's required, socially distancing. So any way imaginable, it can be done.
And that's only because of COVID, because prior to that, you had to do face to face, right?
I had to do face to face in the local area. You were allowed to do it. It was never touted to do Zoom meetings as an example. COVID really brought that out and opened up the door for us to be able to do this. And that's why I'm expanding where I'm writing. So I can deal with people. I'm dealing with a lady right now in North Carolina.
It's interesting.
Wrote somebody in Nevada.
It's interesting. We all have different types of clients, all of us. But when you were telling us before the show that sometimes you run into people that just don't get it. They want to explain to you about Medicare and Medicaid. They're not listening to you. And that's tough.
We all have that in our professions where people are explaining to us what we're the expert.
What we're all about.
And they
Right.
want to show us how smart they are,
Right.
and they
You
have
have-
no idea what they're talking
No.
about.
They have no
You
clue.
have to know when to walk away.
Yeah.
Take your foot out of the door.
That's it.
Yeah, because
Anything special coming up that you want to tell the world about? Anything new?
Right. No, just annual enrollment period approaching. Please, if your family member or a friend, anybody that has Medicare and is confused or has questions, feel free to reach out to me. And please, I hear all the time, well, I'm going to get this plan because that's what my neighbor has, and they say it's the best. There is no such thing as the best for everybody. We have to work to see what's the best for you.
beautiful. Thank you, Mike.
Darren has the best for everybody.
I have
This
the
one.
best. Mike, we thank you so much for being on the show again. You're always a
Again, you
pleasure.
slammed it, buddy.
My pleasure, my honor. Thank you.
Yeah,
Slammed it.
exactly. Good job, Mike. Again, thank you for being on, and you have a great night.
You too. Thanks,
All
guys.
right, pal. Thank you.
All right, my friend. So another great show. Mike always puts on. You know what? He gets some great information. We had some fantastic questions tonight.
We don't even have to be here when he's on, because
Yeah,
he
we
can
can
talk
touch it up.
forever about
Pick it
what it
up.
is that he knows it all. He really is expert in what it is that he does, which is really great.
He really is.
So that's it.
One other thing I want to mention before we get off the air, because I told Brittany I would do that. So she's doing a fundraiser, and from what I'm seeing, and correct me if I'm wrong, Brittany, but she's doing a fundraiser that is a cycle fundraiser, where she's going to
The writing.
riding, right? Where she's going to do that, and
But I think it's virtual or something.
it's
if I read-
virtual, right? Yeah,
Right.
so she's gonna be doing it virtual, and she's raising money for people that are afflicted with the same diseases that she has.
Well, why don't we tell everybody what it is?
Well, it's Crohn's disease. We
Right.
had her on a couple of weeks ago.
Mhm.
What I'm going to do is I'm going to put up the link for it through the Crohn's Foundation to help support Brittany and her team. Okay, it's the Pink Positive team.
Sponsored by the Business Power Hour with Darren and the Music Man from
Yep.
New York.
Yes, exactly. So guys, go there, support Brittany, the Crohn's Foundation, and all the great work that they do. I want to thank everybody for joining us tonight. I mean, we had a lot of people, a lot of great questions. Guys, Medicare and Medicaid is no joke. Just like anything in life, you need the experts to help you. Mike is the expert. Go to Mike. He can help you. All his information is posted. You guys can see it. You can ask Medicare Mike is the easiest way on Facebook, and you can find him there.
And we thank everybody for listening tonight. We're getting crazy numbers, and we thank you all very, very much. And if anyone is interested in being on the show, there's just a couple of dates left for the year. And before we start booking next year, as crazy as it may seem, just give us a call, 631-698-9696. And I have no problem in helping you. And Darren, your number is?
My number is 844-987-CBMS. That's 844-987-2267. You can reach me.
All right. And hope everybody has a good week. Have a great, great weekend. To all our Jewish friends, happy holidays to you.
Happy holidays, safe holidays,
Well.
everybody. Okay. And everybody stay safe and stay socially distant.
Amen. Good night, everyone.
Good night, everybody.